Welcome to the Pod of Inquiry, pushing the envelope for human understanding and optimization, the podcast for podiatrists. The Pod of Inquiry is designed to empower you with knowledge. What happens from there is up to you. Your host, Dr. Stephen Barrett, has designed this show to take you down some very deep rabbit holes, hopefully bringing you back out again, relatively unscathed, but cerebrally whipped, enabling a better understanding of all things worthy of inquiry. If you have more questions after the show, then that is good. The new discovery today many times was the new discovery 50 years ago, only to be suppressed or plainly ignored. Medicine and surgery can sometimes take a long while to get their paradigm shifted. We hope to have a lot of fun on this show and maybe destroy some ridiculous dogma along the journey. Thanks for joining the show today. Let's start spelunking.
Wow, spelunkers. Hello, everyone. This week I'm having Dr. Emily Rowe back for another episode because she just captivated me so much with her great stuff that we recorded for Season 2, Episode 25, that I had to have her back. Dr. Rowe and I discussed acupuncture and traditional Chinese medicine in that episode. If you haven't listened to it, I'm sure you will want to go back and check it out after hearing today's discussion, where we dive pretty deep down into the cave, discussing Lyme disease, associated co-infections, and some other cool things I'll bet you have not heard, or at least not remembered. Dr. Emily Rowe graduated from the University of Miami Miller School of Medicine in 2004. After a brief time in the field of internal medicine, she, to say the least, got a little bit frustrated with the Western approach to medical management of illnesses. She realized that she was being trained to treat symptoms of disease and its end-stage complications while failing to address its root cause. Dr. Rowe goes beyond the world of conventional medicine by combining her intellect with intuition, and she holds multiple paradigms in her mind simultaneously. Using a customized, patient-centered approach, she digs deeply into the root causes of diseases using cutting-edge laboratories and awareness of how ecological toxins can affect health. She embodies empathy for her clients, and she has had extensive personal experience with medical issues related to environmentally acquired illnesses. Treatment plans for her patients are individually created and often combine a variety of methods, including physiological detoxification strategies, eradication of stealth infections, vibrational resonance healings, meditation, hypnotherapy, and ancient wisdom practice such as shamanism, acupuncture, and herbal medicines. As a result of her work as a healer, there is a higher level of conscious awareness of the environmental ramifications of toxins on chronic inflammatory diseases, leading to insights about macrocosmic and microcosmic relationships and profound healing and true etiological resolution. So let's get this spelunking expedition started. Please enjoy my conversation with Dr. Emily Rowe. All right, I'm back with Dr. Emily Rowe. Emily, thanks for coming back on the show. We talked about so much great stuff the last time that we had to get you back on and talk about Lyme disease. So I'm pretty excited about having this opportunity to pick your brain a little bit.
Always a pleasure. Always a pleasure. And I'm happy to share anything I know.
Well, we'll have to have you back for about another 55 episodes then. So, well, let's talk about Lyme disease and, just a little historical, primer for the audience. That it's referred to Lyme disease because in Lyme, Connecticut, mid-1970s, they had this outbreak of juvenile RA. And turns out that it was really due to this horrible bug, Borrelia. And I guess Dr. Willy Bergdorfer was one of the guys who identified it here in the U.S. So you can correct me because I know that they have different species in Europe. And so that's why they refer to it as Borrelia burgdorferi.
Burgdorferi. Yeah, exactly. And there are some other species, and there's even other species within the United States. For example, there's a lot of Borrelia miyamotoi in the U.S. and whatnot, and they do present slightly differently. Also, I have seen, like, if you do, conventional labs, that some of the European strains don't always show up in the American tests. And so there is an art to diagnosing it. And I think it's probably extremely underdiagnosed.
Right. I have a feeling that
it's endemic in, certain areas of the United States. And when we see these patients with these migrating arthralgias and chronic fatigue, I was really impressed, by Horowitz's book that you steered me to. Thank you for that. That, even in Alzheimer's, there was something, I guess there was some fellow up in Harvard who had taken, I forget how many brain samples, but found that like 70% of them had DNA from Borrelia in the brains of people who had died with Alzheimer's disease. So this thing is, it's kind of wily in the way it presents with some of these folks.
Yeah, I mean, it's truly a stealth infection in that I really think it's underdiagnosed, and it's often a driver behind a lot of chronic health conditions. I see Borrelia being associated with a lot of autoimmune processes. And in some of my clients, once the Borrelia gets properly treated, all of a sudden the autoimmune processes go into remission. Now, is that always the case? Definitely not. But I do see that as a factor. Bartonella in particular causes small vessel disease. So Bartonella is another type of tick-borne infection, but Bartonella can also be transmitted by mosquitoes, sandflies, and fleas. And Bartonella was first described in the 1980s in HIV/AIDS patients, and it was around like centuries before they found like cavemen who had Bartonella, but nobody had described it in medicine until the 1980s. Just to clarify, and Bartonella is interesting because it's an obligate intracellular parasite, so it can't live outside cells. So testing for it is complicated because once the cells die, it's hard to find it, and so Bartonella is even more difficult to test for than Borrelia. But Bartonella is associated with small vessel vascular disease. And so you'll get inflammation of the blood vessels all over. And there's a very interesting clinician. His name is Dr. Mosiani, and he presents almost every year at ILADS on Bartonella. He's one of the Bartonella experts. I think he's at a university. I can't remember which one at the top of my head. But he got into studying Bartonella because he was looking at small vessel disease of the brain. And Bartonella will affect the endothelium of all the blood vessels. And so you'll see chronic vasculitis and horrendous neuropathy and chronic foot pain with Bartonella. The other thing you'll see with Bartonella is an interstitial cystitis picture, meaning like the bladder is inflamed, but you go to test and there's no infection. Borrelia can inflame the bladder as well. A lot of these pathogens will colonize the uroepithelium of the bladder, which is the inner lining of the bladder, and causes chronic inflammation. So you feel recurrent urge to urinate, burning, and you feel like you have a urinary tract infection, but then you go to the doctor and there's none.
Right.
So, it's clinically complicated. In our clinic, because we deal with people who have often failed conventional medicine, we also have a lot of clients who just don't want conventional medicine. They think outside the box. But as a screening tool for all of our initial functional medicine clients, we use what's called the MSIDS, which is a screening questionnaire that Horowitz developed.
Right.
Yeah. It's interesting.
Well, one of the things that I want to get into the diagnosis of this, but one of the interesting things, there's so many interesting things when you start to look at this. First of all, this Borrelia it's a spirochete, very, very similar to syphilis, but it's a nasty bug because it can live in these different forms: the cell wall, the cystic form, and then intracellularly. So that in and of itself gives you the idea that, hey, this is going to be a harder thing to treat than maybe a lesser bug on the spectrum of the pathology. And then the other thing is that it seems like and correct me if I'm wrong, because I don't have the percentage, but in Horowitz's book, he talks about that it seems like more often than not, there are other co-infectious agents that are sadly in this patient.
Yes.
In addition to the Borrelia.
Right. Well, and I mean, the very interesting thing about Borrelia, and to me, it's like biologically fascinating, is, Borrelia is a microorganism that can live inside a tick. It can live inside a dog. It can live inside a raccoon. It can live inside a deer. It can live inside a person. And it'll turn on and off different genes depending on its environment. And it'll also go into different phases, like you said, of existence. So there's a biofilm version, there's a cystic film, there's a cystic version. And so when you treat, you don't just give a single agent, and they've done studies that show that, years ago, they would just give like doxycycline for 10 days when you have Borrelia. And there's studies that show that when you do that, the Borrelia just shape shifts into a different form, and you end up really not adequately treating.
But yet, let me interrupt you though.
Sure.
But yet, if you look at the CDC recommendations and even a lot of the stuff that comes out of the infectious disease world, they haven't acknowledged that. They're just, just like, oh, give them 10 days of doxycycline and everything's all good. And then, Horowitz pointed out that really, if you just treat with one agent when they're first in an acute situation, okay, they know they were bitten by a tick, but a lot of people don't even know that they were ever bitten by a tick.
Correct.
Right. And they never had the skin rash and so, but let's say luckily they're diagnosed with the tick bite, but then they go to their regular guy and they give them 10 days of doxycycline. Well, 70% of the time Horowitz says that takes care of it, but then the other 30% are left in this quagmire of chronic disease.
Yeah, and there's some interesting genetics behind, who gets chronic Lyme and who doesn't. And I think it's probably not just genetic, but it's also has to do with, the toxic burden of the individual, the health of the immune system, stress level. I think it's probably very complex and multifactorial who gets chronic Lyme. But there's, studies that show that the genetics of people with chronic Lyme, they tend to have less tertiary bile acids. Now that's fascinating, right?
Right.
I mean, and so, supplementation with things like ox bile can help you clear the infection and all sorts of different things. But it is medically complicated. And there is dissent within the medical world. A lot of healthcare practitioners, physicians and, nurses and PAs do not believe in chronic Lyme, but it's very interesting when you go to ILADS, which is the International Lyme and Associated Disease Society. And my husband and I are both ILADS members. So they argue that chronic Lyme does exist. And a lot of it's really interesting to go to these conferences. A lot of the doctors who are there, they got into it because a loved one was sick or they got sick themselves. Right. And they couldn't find answers. Even the testing is extremely complicated because one of the things that happens with Lyme is it actually evades the immune system. And part of how it does that is it will burrow into the lymph node and basically destroy your lymph node and your ability to make antibodies. And so if you are not making, IgM antibodies, which is, the acute antibodies, it doesn't show up on the test. And 50% of people who actually have Lyme test negative on the conventional labs.
And is the PCR the conventional?
No, so the conventional is a Western blot and ELISA.
Okay. All right. So then in order to get a really good test, like let's say we have this patient that we suspect based off of Horowitz's MSIDS questionnaire that, there could be something going on here. What tests do we run and how do we access those tests? Because I'm guessing they're not going to be at your regular local lab.
No, they're not at your regular local lab. And it's helpful to find a Lyme practitioner who understands how to differentiate between the different co-infections and signs and symptoms so that you can focus on which test to order. And I mean, that's the art of medicine. And, you know, some clients are poor historians, and a lot of clients have neurological issues because of Lyme and might not be cognitively clear as well. You know, so
Right.
so it is complicated taking a medical history from somebody who's very sick, and then there's the art of, you know, looking for certain things like signs and symptoms. So Babesia, which is a co-infection, is associated with shortness of breath and air hunger, even though, you know, the pulse ox is normal and they've been told a million times I've had chest x-rays, I don't have pneumonia. And then, you know, Bartonella will be associated with specific striae on the skin. Like you have these little lines that look like stretch marks.
Right.
They don't follow like your general stretch mark lines. So there's certain like lines built within the skin that
Right.
stretch marks naturally follow. So there is an art to the physical exam and the history and knowing which test to order. There's two companies that we really like at our office and we use. I'm not paid by either of them, but I use them personally. One is IGenix, and then two is Infecto Labs.
Mm-hmm.
IGenix has antibody testing that I find is more works better than the regular labs from like Quest or LabCorp. And then they also do PCR, and they will do like ELI spots and whatnot.
Right.
For all your co-infections. And then Infecto Lab is actually T cell reactivity. So the beauty of T cell reactivity is it doesn't use antibodies. If your immune system is impaired and you can't make antibodies, it's hard to know. And it's also the other problem with antibodies. And thank God for COVID, because now we all know what antibodies are, right?
Right.
So
Right.
the other problem with antibodies is, you know, you could have gotten bit in as a kid at summer camp and been treated with antibiotics, and you totally cleared the Lyme, and then you still have antibodies. And are these antibodies from a local, a recent reactivation, or are they old antibodies? And it's hard to know. So that's the beauty of the T cell reactivity testing and why I like the Infecto Lab so much. And for me, it was very clinically useful in my own health. So, you know, I had chronic Lyme. I had Borrelia, Babesia, and Bartonella.
Oh, the whole three.
Right. And I've cleared all of them.
Okay.
But it was, you know, not easy. I ended up doing a PICC line and a series of IV antibiotics twice. So the first time I cleared Borrelia and Babesia, and the second time I cleared the Bartonella.
Mm-hmm. What about the incidence of heavy metal exposure? It seems like that's pretty prevalent as well. And do you think that first of all, is that a pretty high percentage? I you know, from Horowitz's book, it seemed like it was more common than not that, you know, these people
honestly, when I first started doing this testing was probably 2015. I was absolutely shocked by how many of my clients have heavy metals. I'm shocked when I see somebody who doesn't have heavy metals, because then I'm like, oh, maybe they're not detoxing.
Yeah. Right.
Unfortunately, I think it's environmental toxins are very prevalent. I personally had a very high heavy metal load. I had, 8 mercury fillings from the 1980s. My family members were from Pittsburgh and worked in steel mills. And so I think I probably, there are certain heavy metals like mercury can be transmitted through the placenta. So I wonder if part of it was that. And then the other thing is that I had an occupational exposure because I worked in a field called microbial bioremediation, where we would clean up toxic waste sites using bacteria. And so, I used to work with uranium every day. And when I got my test back, I was like off the chart in niobium. And I also lived in China, which is when I was studying acupuncture in China, the air quality is horrible. So you literally
Right.
breathe in the heavy metals. So, my case is unique by how high my toxic burden it was, and still continues to be. I'm still detoxing. And that's the other thing. It does take a long time. It took 40 years for all these metals to accumulate in me. It's going to take a while for them to come out. And some clients have the misperception that we can, undo 40 years of toxicity in like a month or something. And that's just not possible.
Right.
Yeah.
Now,
And
so as far as, let's circle back a little bit to
sure.
the heavy metal exposure, toxin exposure. I mean, you're right. It is everywhere.
And mold.
Well, that
Yeah.
was, so I guess which comes first, the chicken or the egg? I would suspect it could be both ways. I would suspect that if you get a tick bite, it could, maybe if you were pretty clean, relatively speaking, it might not present as much as if you're laden with mold or heavy metal toxicity. What's your gut instinct on that?
I do agree that I think this stuff we're all unique individuals, and this stuff is extremely complex medically.
Right.
Personally, I was able to compensate for years with Lyme. Like I made it through medical school and Chinese medical school and ran a successful practice. And then when I had cancer and went through, surgery and radiation to treat the cancer, all of a sudden the Lyme had a party.
Mm-hmm.
And then that was around the same time when I was very sick. So I was staying at home and my home had mold. And so it was just like it would like turned into the perfect storm. And, when I talk to my clients, a lot of times they have another perfect storm kind of issues, granted different, like, oh, I had a bad car accident. The car was totaled and, I was in a neck brace for 8 weeks and my father died, or I was taking care of, my special needs child, or I got laid off from work. And so you'll see this conglomeration, and then all of a sudden, whatever coping mechanisms and holding mechanisms are there stop functioning. And so often it's a straw that broke the camel's back. And as you work through these cases, it's like peeling an onion. There's layers and layers to it.
So I want to circle back because I think I said something that might not, be reflective. In Horowitz's book, he recommends for an acute exposure of a tick bite, at least 3 weeks of antimicrobial treatment, and versus the 10 days that you're going to get if you went down to the local hospital. Did he also recommend additional antibiotics to hit the different forms of the Borrelia, the cystic, or do you?
So that's not necessarily the case with acute.
Okay.
And of course it depends how sick the patient is. And a lot of people, we've had actually, because we have some, blogs and mention of Lyme on our website and Lyme testing, we've had local people reach out who had recent tick bites and, the EM rash and know to come in. And then they got, the ILAD's recommended treatment, which is, the 3-week course with, usually you do azithromycin and doxycycline minimum. But, some people have reactions to certain things and whatnot. So yeah, and it depends. And then, the other thing you can do that a lot of people don't realize is if you do find the tick attached to yourself, you can remove the tick and you can send it off for testing to know what the tick had. And there's a very interesting website run by the state of Pennsylvania. And because it's, the state of Pennsylvania, there's no financial incentive for them to publish certain information. So I think it's free for people who live in Pennsylvania. I'm sorry, I'm just opening a sparkling water here. And you can send the tick off and they'll check for free for Borrelia. And then if you want to add co-infections, you can check for co-infections. IGeneX also does tick testing. There's a couple other labs that will test the tick. Right. But when my dog got bit by a tick, I sent the tick off and thank God the tick was negative. Wow. But what's really interesting about the Pennsylvania Tick Lab website is they have a map of the United States, and with each state, and you can like hover over Florida, and you can see that 38% of the ticks sent in from Florida had Lyme. And a lot of people say, oh, there's no Lyme in Florida. But like there's like physical evidence from this lab that it is. And so you could look at Georgia where you're at, or any other. But it's very interesting. And, you know, part of what's going on, I suspect, and there have been studies that show this, but I think we definitely need more research, is that as you know, wilderness is destroyed, and you know, you go to New Jersey and like the deer are living in people's backyards and stuff like that, because where else are the deer going to live now that there's no woods? And so there's these shifting ecological systems, and I think part of public health needs to be awareness of, you know, the shift in ecology because of the destruction. And so now, you know, instead of having like deer as the carrier for Borrelia, humans are becoming the new carrier.
Wow. That's frightening in a way.
It's another level.
For sure. All right. So acute, just to have in your family health pocketbook, so to speak, we're not going to go for 10 days, and we're going to go with some multiple antibiotics for a minimum of 3 weeks.
Yeah. And what you could do is you can go to the ILADS website. It's ILADS.
End of the day.
ILADS.org. And they have a find a practitioner where you put in your zip code.
Right.
And you can find a practitioner who's trained in the ILADS protocol.
Okay.
The other thing you could do with an acute bite, like I said, is send off the tick for testing, which I find very helpful. And then, you know, there is, even just a lot of the natural tick repellent and sprays, the citronella. We carry a lovely product here. Again, I'm not paid by the company, called Herbal Armor. That's a non-toxic, deep-free insecticide that I use because Florida, we're just swarming with mosquitoes, and we're actually having some malaria found in Florida right now. So.
Yeah, I read about that like a week or so ago. That's I thought we had that eradicated.
Yeah, well, and malaria is interesting because it's actually just like you said before, Borrelia is a spirochete, just like syphilis is a spirochete. But Babesia is like the cousin of malaria. They're both in the same family. So a lot of the medications for Babesia are used to treat malaria.
Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor.
I'm excited to announce that we have a new sponsor for the show. Dr. Ed Glazer's Relax, Release, Relief Technique and Training is now a sponsor of the Pod of Inquiry. I call this technique the Triple R technique, and it's truly amazing. He has actually performed it on me. By asking your patient to point where it hurts and have them tell you what motion hurts them, you will know exactly how to position them. They will then lightly push against your very focused light pressure, so minimal pressure that they can barely feel anything. A few seconds later, you will feel a softening of their tissues under your fingers as the patient's skin separates from the deep fascia and suddenly slides. This is the release part of the technique called Relax, Release, Relief. It's a deep relaxation technique that reduces or eliminates almost all pain. 10 minutes after the release, most musculoskeletal pain is gone. The range of motion increases dramatically and permanently for most people. Muscle spasms, including trigger points, are gone. Duration of relief or recurrence is dependent upon the underlying cause of pain, which in most cases has already healed. It does all this by resetting the pain threshold. It's as easy as flipping a switch, and the results are astonishing. I know, I've had the experience myself. What I'm saying is you learn this technique and you'll be able to relieve a lot of musculoskeletal pain from surgeries, trauma, implants, and other diagnoses, including fibromyalgia and CRPS. Dr. Edward Glazer is the inventor of the Soul Support Mass Posture Orthotic and is teaching the lower and upper body in 2 weekend courses. I personally have experienced this treatment, as I've said, from Dr. Glazer, and it does relieve pain, and the technique is painless. Space is limited for these courses to 14 students in each class. Just go to rrrtv.net/course or tap the QR code on the screen to register. You'll want to really do this because it will empower you and give you a technique that really helps people and really will differentiate your practice from almost any other practice. Dr. Glazer's teaching 2 courses. Course 1 is feet to low back, and course 2 is upper body. Now, the first course, feet to low back, is being offered on October 4th and 5th and November 11th and 12th. And the upper body course is being offered on October 28th and 29th and November 18th and 19th. So go to rrrtv.net/course and get signed up for these today.
So let's. I don't want to get too tangential. I apologize if I'm
no.
all over the place.
I think you have to get tangential when you start talking about this, and you see all of these, co-infections, the Bartonella, the Babesia. Heck, he even lists out all rickettsial infections, chlamydia. I mean, it's amazing how it's not just. It's probably more often a multiple situation, ergo that's why he has the MSIDS questionnaire for multiple than just a single organism, which makes it so complex. And
yes, and that's where we can get into chronic. So if I suspect chronic Lyme, often the first suspicion, like I said, we give the MSIDS questionnaire when people come in the clinic, and if you score higher than a 46, there's an 85% chance that you have Lyme or a co-infection. Okay. I also find, though, and here's the hard part, mold toxicity very much has similar symptoms to Lyme. So the other time I see a high level on an MSIDS questionnaire is mold toxicity. Right. And then if they have both, then their score, instead of being 46, is like 120.
Okay.
So, but yes, mold toxicity is complicated. It will complicate like the Lyme. And a lot of times people, I suspect, will have Lyme for years and then they get a mold exposure. And like I said, it's the straw that broke the camel's back. So, that's my first concern. Now, the main things I see personally in my clients who end up having chronic Lyme are migratory joint pain. Mm-hmm. And what that means is like one day their back goes into spasm and it's like the worst spasm of the world and they're having trouble like walking and have like, strange gait. And then that relaxes and that goes away. And then 2 weeks later, their neck goes into spasm or they have the worst migraine in the world and that goes away. Then they have tennis elbow and that goes away. Then like their ankle blows up. And so you get this weird migratory joint pain. And, I've had some of my clients say, well, I don't have joint pain. I'm like, well, what do you have? They're like, oh, I have muscle pain. And it's really, you can argue about semantics, but yeah. And then the brain fog and fatigue, and insomnia, but really, neurocognitive symptoms that don't make any sense, like clinically.
Now, one of the things I recall from Horowitz's book was the migrating arthralgias is almost pathognomonic for a Lyme or a Borrelia, which I thought was really very interesting because we see this all the time. A patient will come in and they'll say, well, sometimes my Achilles tendon hurts on the right side and then it gets better. And it's the other side and in my knee or, that if the listener takes anything from this little episode that we're doing on Lyme, that would be maybe one of my key clues to think about when somebody is complaining of these migrating joint pain symptoms, that should raise the antenna and say, okay, we maybe really need to look at Lyme. And it's amazing when you start looking for stuff, how much you find. I mean,
oh, definitely.
When we first started dabbling in, trying to really, instead of just being surgically oriented in peripheral nerve decompression, and then all of a sudden these patients would still have symptoms and everything. And then all of a sudden you ask them a simple question. It's like, well, is there any Lyme any mold in your house? It's like, oh yeah, we've had mold all the time, for years and years and years. And it's like, then you test them and they're filled with ochratoxin and all of the other Stachybotrys. It's just amazing what comes back. Same thing with the heavy metals. you start looking for that. Have you had any heavy metal exposure? No, I don't think so. But, we, had a well that went bad or something. There's all kinds of stories. And that's why it's so important for you to just converse with these patients and get that HPI so that you can try to start looking at these different things. Like, all right, I need to look under this rock. I need to look under this rock. And, so.
And, that's one thing that's really special about my practice. Acupuncture is not a one treatment thing. So a lot of times people will come in, once a week for 3 months for a series of treatments. And it's very different than, the functional medicine side of our practice, where you come in, we do some testing, we try some supplements, you reevaluate in like 3 to 6 months. But when somebody's coming in once a week for 3 months, you really get to know them well, and you get all these pieces of the puzzle, like what you're talking about. You and I could hang out. We could go to the Bahamas together and hang out for the whole weekend, and you couldn't tell me about your whole life. It's just impossible, right?
Right.
So
that's because my memory is very bad. And I have brain fog. So there you go. But yeah, you're right.
No. So I had a client, I was treating her for years, and she was coming to me for headaches, and she had had headaches since the time she was 5 years old. And she had a very complicated medical history. She had an aggressive cancer at the age of 28, and then a recurrence later in her 30s. And we started talking after I'd been treating her for about 2.5 years. And she told me that as a child, she lived down the street from the Monsanto factory.
Okay.
And that, she was taken to this local famous hospital to have like CAT scans of her head because she was having debilitating headaches at the age of 5, and they needed to check her for a brain tumor.
Yeah.
And it was like a huge piece of the puzzle,
Right. Well, let's go into treatment a little bit, because
Sure.
I think treatment is always predicated on accurate diagnosis, for sure. So let's assume that we don't have a heavy metal overload or a mold exposure. We just unfortunately have these, maybe Babesia and Bartonella and, Borrelia going on. It seems like there's a lot of incidents of Herxheimer reactions when you start treating these patients, because they're already kind of set up for that in a way.
Yeah, definitely. And, in our clinic, we usually start one antibiotic and then wait, and then start the second antibiotic and then wait, and then start the third. So, because like if you're treating, just Borrelia, you're using minimum of 3 antibiotics. I'll often usually use herbs at the same time. So I'm a Chinese herbalist. I have a master's degree in it. And that really helps the medications work better. It decreases side effects. And I just find everything works significantly better. Now, you do have to understand, drug herb interactions, and not all herbalists are trained to do this. I also trained in Stephen Buhner's protocol. He wrote a very interesting book called Healing Lyme. And he takes a cytokine approach to herbs. So what he does is he looks at how the herbs modulate cytokines, and what's needed for, to treat Babesia or Bartonella or Borrelia or something. And so I use a combination approach with it. We also do vitamin IVs to help support people. We have, nutritional support that we recommend. Acupuncture for pain. Acupuncture can really help when somebody's having a bad Herx reaction too. And then my husband is certified in a variety of ozone therapies. So we have blood ozonation at our office, and we also have what's called EBU, which is ozone dialysis. Right. So, I find that the people who kind of take a shotgun approach to this tend to do much better. That's what I did with my own health, and I really think it's why I was successful at clearing the infections, whereas I've had other people who've, other clients who've come in and they've seen other practitioners who were just focused on antibiotics, and, they just never cleared the infection. So I think this is, complex chronic medical illness and needs to be addressed as such.
Right.
Yeah.
Now, what I see that they use a little bit of grapefruit seed extract for the intracellular forms of
Right. But then you
Borrelia,
can't combine that with Plaquenil. So, there's like even that you have to look at. And then at one point I took, a medication called rifampin, which is an old tuberculosis medication. And, you can't do any grapeseed extract with that because you'll overwhelm your cytochrome P450. So you really need guidance of somebody who has experienced this because, I had one client who was desperate, who was like buying antibiotics from another country online and trying to treat their own Lyme and really hurt themselves.
Yeah.
So, so when you start mixing stuff, and Horowitz does in his both of his books, he puts some of the herbals that help support stuff, but you do have to be careful with, drug herb interactions. That is a real thing.
Right. No, well, that's why, this is such a complex chronic illness that you really, if you discover it, you really need to send it, these patients to somebody who knows what they're really doing, because it's very esoteric.
Right.
The more I was diving into this stuff, it's like, wow, I feel comfortable maybe, in getting the initial diagnosis and everything, but then you need to send them off somebody like you that can you don't want to overload the P450 and knock out, we know that grapefruits the pharmacy tells you all the time, don't take a grapefruit with this medication or eat grapefruit. And it's because of the 3A4. It knocks out a couple of the enzymes that just, you can't even make the pharmacological transformation of what you need to do. So it makes a lot of sense. What were some of the supplements in addition that you took in your own journey with this?
So for me, resveratrol, which is derived from Japanese knotweed, helped a lot. I used a lot of methylene blue.
Okay.
Which is not a supplement; it's a compounded, medication.
Right.
But methylene blue was key for me clearing Bartonella.
What kind of dosage were you taking? Because a lot of the biohackers will take small doses just for, getting that electron donor effect and from a neurocognitive boost.
So I started because of sensitivity and Herx reactions, and I needed to function at work. I started at very low doses, and I started at 2.5 milligrams once a day. Okay. And I wanted to die that first week. It was so bad. And then eventually I increased 2.5 milligrams every month until so I started 2.5 milligrams once a day. Then I went 2.5 milligrams twice a day. Then I went 5 milligrams in the morning, then 2.5 and at night, until I eventually got up to 25 milligrams twice a day, and a liposomal formula that was easier to absorb because I had Crohn's. Luckily, the Crohn's went into remission when all these chronic infections were cleared. And then what I did in addition is I got a PICC line, and I did IV methylene blue in addition to the pills.
Okay.
And so that I was doing IV 20 milligrams, and I had a PICC line and did 30 days of treatment.
Yeah, it's interesting. Methylene blue, you can kind of gauge your own dose by basically how your pee looks. Because it gives you that green iridescent urine. It's kind of an interesting.
It's entertaining for sure. And then but some of the ILADS practitioners will use whopping doses. Like I'll go to the ILADS and they'll present a case where they use 300 milligrams twice a day. Wow. One of the fascinating things about methylene blue, though, is it's photoactive.
Right.
And studies have shown that when it's exposed to light, its ability as antiviral and antibacterial increases. So I would do concomitant red light therapy, and I redneck rigged this, for my own health, but I just wanted to get better so bad. But I actually bought a Juve, which is a very expensive medical grade red light, and I would sit in front of the Juve while I did the methylene blue.
Oh yeah, I think I came across a study where they were actually using methylene blue and I think it was Alzheimer's, where they would, actually photoactivate it through the cranium. And
Yeah.
I think it was,
So I had some neurological symptoms, and I have one of those red light helmets that I would wear at the same time too. And I'm sure I looked ridiculous because the red light flashes, and it looks like a bicycle helmet that lights
Right.
up like a Christmas tree.
right.
But I didn't care because honestly, it helped with the neurocognitive side effects so much.
Yeah, no, I mean, if something works, you don't really care what it looks like.
Yeah.
I mean,
Yeah.
you just,
And then a lot of the Chinese herbs I used were very helpful. I used some quercetin.
okay.
That was super helpful. Berberine,
Okay.
which that's the yellow pigment that makes like Vidalia onions yellow.
Yeah.
And
berberine's kind of like metformin.
yes, for sure.
It in effect works on complex 4, right?
Yeah.
But there was one supplement that he mentioned in his book that you mentioned to me, Artemisia.
Yes.
Tell me
Yeah.
what that is.
So Artemisia comes from a Chinese herb called Qinghao, and it actually won the Nobel Prize because it treats malaria.
Okay.
And there was a Chinese scientist, she was trying to derive the active part of the herb. And, Qinghao has been used in the Chinese medical textbooks that I have here behind me, like 2,000 years ago, in these epidemics and whatnot. But they have derived Artemisia. You can get it in pills. There's a pharmacy that's in the Southwest called Verticis. They're at, I think they were at the Ozone Conference.
I think they were. Yeah.
Yeah, so they have an IV version of Artemisia. They also have an IV version of like curcumin. They have an IV version of resveratrol. They have a bunch of these herbal products in IV form. I didn't understand how to use them until I signed up for classes with a naturopathic doctor named Paul Anderson. And he has some very interesting classes on the uses of this. He treats a lot of cancer. But which I've had as well for myself, and I use these products for my own health as just antioxidants. But that's another story. But yeah, Artemisia is a fascinating one. We use it a lot for acute COVID.
Okay.
Yeah, it really helps with the fevers associated with acute COVID, and I see people recover much quicker with less chances of long COVID when I use it.
Very interesting. What about detoxing? So are you doing more of an IV chelation? Are you doing more like just oral EDTA or DMSA?
So it depends on the client. Some clients are extremely sensitive and can't tolerate chelation. I mean, there is another test called the Clifford test, and what it is, it looks at immune reactivity to metals. And you'd be interested in this. They have two versions of the test. They have a dental version and also an orthopedic implant version. And before you get an orthopedic implant, you can actually do the Clifford test to see if you're gonna have a chronic allergic reaction to it. But I did the Clifford test on myself, and I have horrible immune reactivity to mercury, lead, thallium, nickel. And these were all metals that were high on my metal test. And when I would try to do chelation, I would actually generate an allergic reaction to the metals inside of me. So for me, the best solution was a slow, gentle detox. So I use a product called Quicksilver, by Quicksilver, called IMD. Now we have tons of clients who come in and they do chelation with the IV and they tolerate it just fine. Now, often if your lead or mercury is high, though, you need about 30 IVs to really get it out. We've seen that people need way less IV chelation if they combine it with EBU. So instead of 30 IVs of chelation, they'll need about 5 if they combine it with EBU.
Which is
the ozone dialysis.
Right. I think EBU is maybe, going to really come on. I mean, more and more people are starting to integrate that into their practices.
Yeah.
And,
I mean, that was one of the big reasons why I cleared those infections, is I combined the EBU with it. And I I try to be as healthy as possible. Thank God I've exercised my whole life, but I have issues with vascular integrity. And this is common in Lyme patients because part of what happens with Lyme is Lyme produces an enzyme called collagenase. And what collagenase does, it breaks down collagen.
Right.
And your vessels are made of collagen. And so classic in Lyme patients is the vein will look great and you go to start the IV and the vein just rolls away or collapses. And so, it can be an issue starting IVs in Lyme patients. So that's also sometimes a limiting factor. But collagen is in your joints and your bones, and it's part of why you get
everywhere.
that migratory joint pain.
Right. No, it's everywhere. I mean, I can't think of a tissue that doesn't have collagen.
Yeah, no, for sure. And this is where we could go back to our previous acupuncture lecture or discussion, about collagen and the effects of the fascia and the whole system. And I think the whole fascia systemically gets affected when somebody has Lyme because the collagen gets literally eaten.
So how often do you see like thrombocytopenia in these chronic Lyme cases? Is that a common?
Very often. Especially with Bartonella, more than Borrelia.
Okay.
No, and then that's one issue, because IVs can be irritating to the skin. They don't cause blood clots, but it can be a risk factor. So if somebody, I'm sorry. I was thinking thrombosis. You said thrombocytopenia. So thrombocytopenia, so thrombosis I do see associated with Bartonella. My apologies, because of the small vessel disease. Now, thrombocytopenia I see associated with anaplasma and Ehrlichia, which are two co-infections that we didn't even talk about.
Right.
But that's really when I see the thrombocytopenia.
So if you have a couple of these bugs and then you have the patient that comes in and they have a low platelet count and they bleed really easily into their skin, a little bump or a bruise, that might be an indicator there too to think about
no
something.
And a patient like that, you're not going to do Ebu, you're not going to do ozone, you're not going to give them heparin, so this is where each individual needs their own protocol.
Exactly.
And then, you do have to consider, as you give medications, which can, affect blood cells and whatnot, and thrombocytopenia, just in case anybody doesn't know, is low platelets, right? So you do need to check, a CBC and a CMP on a regular basis if you're on these heavy duty antibiotics. I mean, that's super important. You have to follow up and be in the office on a regular basis.
Yeah.
Just for monitoring, you can't just
diet, talks about, you want to try to decrease the sugar in the diet, obviously, and also yeast in some patients because of the, overload that you get,
Oh, for sure. And if you're taking antibiotics, I mean, you take a 20-year-old woman who has a urinary tract infection, you give her antibiotics, she gets a yeast infection.
Exactly.
So there is like an order to how you treat. And so for this, I almost always treat mold toxicity first, because if you take a patient who has both mold and Lyme and you treat the Lyme first, if you give them antibiotics, the mold gets worse. And so the person can't clear the infection and they don't get better. So mold toxicity is treated first. So this is also where, the order of is important.
So that goes back to the essence of making all the right diagnoses. And, I think there's a fallacy in medicine that has been perpetuated in the training. And that is, everything is caused by one thing. And we know that is not the case. And so that's why, very accurate diagnosis is going to help you figure that out. If you didn't know that they had mold, then, you wouldn't be able to treat it primarily. So I think that's a good take home message for everybody. Emily, we've got kind of a hard stop tonight because of a commitment, but I love talking to you.
I do too.
Can you sum up just maybe a few of the things that we talked about? If
Sure.
like the practitioners in there, the migrating arthralgists, stuff like that, just a few bullet points before we wrap up.
So my key red flags to when I'm like thinking, oh, this person has, could possibly have Lyme or another tick-borne infection is chronic pain that migrates. Number 2 is fatigue that doesn't get better with rest. And 3, they don't seem to respond well to anything. And that's when I start thinking, oh, they have a chronic infection. And it's not just borreliosis. It's, as we said, all these different things. And that's why Horowitz calls it multiple systemic infectious disease syndrome, because often they have a chronic mycoplasma pneumonia combined with a Borrelia combined with a Bartonella. And, when you look at this stuff, it initially can be very overwhelming. You're like, oh my gosh, how can I help this person? And it's very easy. You peel one layer at a time.
Mm-hmm. They're all onions. You have to get, I have referred to my complex peripheral neuropathy patients as onions for decades. And it's like, you got to peel that first layer off and see what you got. And then you got to keep going until you get down to the good.
So that would be my clinical summary by how I work. I mean, and I really do a thorough, assessment. And often the problem list for one of these clients will have 28 things in it.
Yeah. Yeah. Well, you just look at Horowitz's MSIDS questionnaire and it's rather lengthy, needless to say.
Right. And you can easily download the MSIDS. You can just type in MSIDS questionnaire on the web, on any internet browser.
Yep.
And it'll pop
come
up and you can use that to just screen. And even if you don't do the diagnosis, even if you just refer to somebody, it might be the first time somebody's even considered that they have Lyme.
Right. Well, I think if you have a patient that comes in with, like you said, chronic fatigue syndrome, pain that's migrating everywhere, they're just sick, high incidence of peripheral neuropathy. There's also
high incidence of autoimmune disease too.
Very much. Yeah. So that just gives, I think, the practitioner one more avenue to start looking down and getting them plugged in at least into the right area. It's very empowering to be able to make a diagnosis, and then that allows for proper treatment and getting them the right referral. So that's excellent.
Yeah. And as you said, there's layers. And even I have a client I saw today, she's got this nausea and it's multifactorial, and I am trying to explain this to her and she keeps looking for the magic bullet. And I'm like, I'm just being very honest with her. There is no magic bullet,
Right.
She's got
we all want a magic
complicated situation.
We all want the magic pill, and I've yet to find it. But
if you find it, let me know.
I will.
Because every time I thought I found it, somebody was selling me something.
Yeah, exactly. So, Emily, thank you so much. I love having these discussions with you. I learned so much, and look forward to getting you back on and talking more about this. I'm sure the audience is going to love this because it's very user friendly stuff that they should be able to plug into their practice tomorrow.
I hope so.
Yeah.
Thank you so much for inviting me.
You're welcome. You're always welcome. Anytime you want to share something, just give me a call.
Okay.
Well, folks, if you are over 40 and you are not using a supplement to augment nitric oxide production, you should really think that. This molecule is absolutely imperative to health, not to mention its cardio protection. If you have any question on nitric oxide, I suggest that you go back and listen to the Pot of Inquiry, Season 1, Episode 3, for my conversation with one of the world's experts, Dr. Nathan Bryan. I never miss a day of nitric oxide supplementation. That's how important I believe it is. Long overdue, there is now a nitric oxide replenishment formula without the fear of oxalates. Approved Medical Solutions does not use beets, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBarrett, all lowercase, at checkout, and you will receive a 10% medical discount savings. For licensed practitioners, go to approvedmedicalsolutions.com and register. They have unique bundles for all of the full-fledged spelunkers of the Pod of Inquiry. Use Pod of Inquiry at checkout after registration, and I'm certain you will be pleased not only for yourself, but all of your patients. Here's a little secret. If you order their testing strips and test every patient for a few clinic days, you will see every one of those patients will be nitric oxide deficient. When they see this result, they will want you to start them up immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates.
We hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes, found at our website, podofinquiry.com. If this incredible and educational conversation has tickled just a little bit of your cortex, please leave us a review and spread the message to your friends and colleagues. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show, if used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.